Hi, and welcome to the Organism Series. Today we're going to talk about Bacillus cereus. As with some other organisms, depending on the patient and the mode of inoculation, B. cereus can cause a variety of different syndromes. The first is the emetic syndrome. This usually has a short incubation period, has gastroenteritis symptoms, and tends to resolve within 24 hours. It's most similar to Staph aureus food poisoning, but if the patient has a significant load of the emetic toxin that causes this, the syndrome can lead to acute liver failure. The second syndrome is the diarrheal syndrome. It's very similar, but it has a longer incubation period and looks more similar to Clostridium perfringens acute GI disease. Then the last syndrome is invasive extraintestinal disease, and it can go pretty much anywhere, but has a known association with bacterial endophthalmitis after trauma. It's much more common in immunocompromised hosts, but it can happen in anyone. In the microrealm, B. cereus is a facultative anaerobe and it's spore forming. On gram stain, it's either a gram-positive rod or it can be a gram variable, as seen here in the stain. It shows up everywhere and can be really hard to sterilize, especially when there are spores present in food. And although B. cereus GI disease is famously associated with reheated rice, it can show up in other foods as well. Although any patient can get invasive disease, there are certain risk factors that strongly increase your risk, including the presence of a central line, neutropenia, and IV drug use. Interestingly, there are multiple reports of pseudoepidemics due to contamination of lab instruments, once again demonstrating the difficulty of sterilizing this organism and its toxins. Diagnosis gold standard is culture, but it's important to know that if the clinical scenario is consistent, there's no need for diagnosis, as it should be self-limited. If the organism grows in a culture outside of stool, it should not be considered a contaminant and should be assessed in the context of the patient. So, treatment has two major components that are each extremely important and have been demonstrated to both be needed for positive outcomes in the setting of invasive disease. So, vancomycin is the drug of choice due to resistance to beta lactams and clindamycin, but just as important is the removal of any endovascular hardware if the patient is bacteremic. As mentioned before, non invasive disease is self limited and thus therapy is not indicated. All right, another interesting and probably more common organism than we think. Check out the rest of the organism series on the Simon Says ID channel.